Can you correct adult scoliosis? When I consult with patients with scoliosis, one of the most common questions I get asked is, can you correct my adult scoliosis? And when it comes to correcting, what does that really mean? When patients ask that question, and of course when doctors say we're correcting scoliosis, to me, correction means curing, meaning that if you're going to correct something, that means you're curing it and it's gone and you're never dealing with it ever again. And to me, that's impossible when it comes to scoliosis, because we know scoliosis is a progressive problem and we know it's completely uncurable because we don't know what's actually causing it. Scoliosis can't be cured. There is no treatment out there that actually cures scoliosis, but it can definitely be treated. And it can definitely be treated conservatively without invasive surgery if things are done properly. So when I look at scoliosis, and the reason why my clinic is called Scoliosis Reduction Center, because the goal is really to reduce curves. You're not going to really be curing curves. Not even surgery cures curves. They're just reducing them. And first of most is to stop progression. When we look at most curve cases, our goal is to stop progression, but we can not only stop it with what we do in our clinic, but we can actually reduce curves. Reducing curves to a smaller side versus trying to cure or correct it completely. Even the goal is to try to get zero curvature at all. Normally we're reducing curves percentages of what they have. After even reducing curves, to me, correcting that problem would also mean that, okay, you reduced it and it's permanent and it's totally going to stay like that and you don't have to worry about it. But we know that's not true, because we know work needs to be done in order to sustain those results and to stop the effect of gravity over time causing curves to progress. So since we can't eliminate the cause, which is gravity, which causes adult progression in scoliosis, we can't say we're permanently changing anything. And this is true when it comes to even surgery. When they do surgical results, it's not permanently reducing these curves. We know curves even progress post-surgery. So no matter what, you're going to have to manage your scoliosis throughout your entire life because we can't eliminate the cause. But if we do reduce curves and we make them smaller, we know gravity has a less effect on smaller curves, so we can get long-lasting changes, is what I like to say. And these long-lasting changes can have a great effect on the body and the way the body heals and the way the body functions, the quality of life, cosmetics, and in total improvement of well-being. So achieving reduction in the scoliosis, even though it's not a permanent cure, and even we know that it's not, you're going to have to maintain the reduction over time, it's still a worthwhile process because the effects it's going to have on your health and well-being over your lifespan. One thing we definitely know, reducing curves is harder in an adult patient than it is in a child, because the treatment plans need to be modified because most adult patients tend to be more stiff. But there is something that needs to be said about being treated in young adults or adults, because they're not rapidly progressing anymore. And since they're not rapidly progressing anymore, we don't have to worry about curves progressing quickly. But we do have to work harder to actually reduce the curve. So normally the initial program is really designed to achieve scoliosis flexibility. Now, why do I call it scoliosis flexibility? Not just flexibility, because a lot of patients can be flexible on their shoulders and their hips and their hamstrings, but when we look at their scoliosis and they do flexibility, I do flexibility studies to see how much the curve reduces under their normal motion. They're very stiff at the scoliosis sites. So therefore, we have to do very specific treatment to try to improve flexibility before we can actually reduce the curves. And when we actually improve flexibility and reduce the curves, the patients notice a lot of their symptoms, especially pain, start to rapidly improve, because a lot of these symptoms are a result of the stiffness. If your joints can't move properly, they're going to hurt. It's just the way it works. So we have to get more flexibility into the spine to help get the body functioning better and healing better. Adults can be more challenging, but most adults definitely are more committed. So normally they can get very good results, just like their adolescent counterparts, if they're committed and towards the process and are disciplined to follow the program. Most common type of adult scoliosis is the adolescent case, or the idiopathic adolescent case that either wasn't diagnosed or was diagnosed and it never progressed to any severe category. And then the curve goes into the adult stage. And when they go into the adult stage, most orthopedic surgeons will say, don't worry about it, nothing we can do about it. But unfortunately, this adolescent case that wasn't treated with surgery or was not diagnosed progresses slowly during the young adult stage and starts increasing its progressive rate over the person's lifespan, and it eventually start leading to problems like pain and dysfunction and degeneration. So this idiopathic scoliosis that was left untreated and said not to worry about becomes a severe problem as patients get older, and they get very frustrated because they say, why didn't they tell me to do something earlier in my life? Which makes much more sense, because if you treat a small curve, it's never has a much less chance of becoming severe and causing more problems if you treat a small curve and keep it small. If you let a small curve become severe, then we're more limited in how much we can reduce a curve. I'd much rather prevent a curve from progressing than taking a severe curve and actually trying to reduce it. But if you are that severe case, we still can reduce it. But my best approach would be, if you know you have scoliosis and you're a young adult, don't let it become severe. Take care of it now. And the second type is something called degenerative scoliosis. Degenerative scoliosis in the adult stage is something called de novo. And de novo means new scoliosis, a new scoliosis occurring in the adult stage. This normally happens because of some type of misalignment or injury or trauma, normally to the lumbar spine, which causes a shift to occur, and the shifting in the vertebral alignment will rapidly start to degenerate and progress, and we can see pretty rapid progression and degeneration in a very short window, 5-10 years. And a patient develops a scoliosis as an adult that they didn't have as adolescent cases. Degenerative scoliosis cases look very different on an x-ray, and sometimes they're very easy to identify. This one is a degenerative scoliosis, or this one is an idiopathic scoliosis or adolescent scoliosis that either wasn't diagnosed or wasn't maintained properly, and now it's progressed in the adult stage. However, sometimes it's not so easy depending on the configuration. Either way, the goal is the same, is to stop progression of the adult scoliosis. Not really to correct it, because we know we can't make it zero, but we want to stop progression, reduce the curve, and reduce the effect on the body. When it comes to adult scoliosis, we definitely treat them very, very differently, because we want to just not treat the pain that the person's feeling. We want to address the structure of the spine. When it comes to structure, if we can really reduce the structure, reduce the scoliosis, reduce the misalignments, you're going to have a much better outcome. This is done by incorporating many different types of treatment. Not only a specific chiropractic care that's designed for scoliosis, but we do in-office therapy. We do customized home exercises designed for your scoliosis. We do corrective bracing. We do self-corrective exercises. We do lots of things that are designed for your specific scoliosis. And this has a benefit because it's all done in one clinic. Many adult patients with scoliosis will start going to alternative types of care, but they go to many different doctors over a long period of time. You need to go see a chiropractor, maybe to go see an orthopedist, maybe to go see an exercise physiologist, to go see a physical therapist, to get a brace, to go see an orthotist, and they're seeing all these different doctors, and everybody's working their own problem in their own way. And what I find is when I review this stuff is that everything's working against each other. Where in our clinic, we do all those things, but we do them in one office. And I prescribe and coordinate everything. So everything's very additive. Everything's very combined in a way that everything will add to the next to get the very best results. So when it comes to adult scoliosis, we know that you're not progressing rapidly. So it's not progressing because of elongating. It's progressing because of compression over time. This compression over time is slow, but unfortunately very steady. And this compression, unfortunately, tends to be painful. And pain in the adult patient is really the number one reason why patients seek treatment. And the second reason is because of cosmetics. As the curve progresses as the adult, the cosmetics become more apparent, and you start seeing more kind of deformities as a result of their postural alignment, their pelvis to torso, torso to skull. So we definitely recommend that you be proactive, that if you know you have scoliosis, try to reduce it younger in life. The younger you are, the better results you're going to get. I'd much rather take care of a 20-year-old with a 30-degree scoliosis than a 50-year-old with a 50-degree scoliosis, because it's easier to reduce a smaller curve in a younger patient than a bigger curve in an older patient. But even in the older patients, we have good results. But of course, across the board, the more flexible your spine is, the younger you are, the smaller your curve is, the better results you're going to get. So the sooner the better is what we recommend. Thanks for watching. I hope you found this information helpful. If you'd like to hear about other topics and information on scoliosis, type in the comments below and let us know. And finally, subscribe and hit the bell icon to be notified of when we publish content. Thanks.